In the second part of this presentation, I'll discuss what a patient with diabetes can do to prevent cardiovascular complications and what can be done to treat them if they were to occur. Let's start with a quick recap of the connection between diabetes and cardiovascular complications, mainly the ones related to atherosclerosis or hardening of the arteries. These include heart attacks, angina, or strokes. If you remember the first part of presentation, we discussed that three conditions, type 2 diabetes, hypertension, and high cholesterol commonly occur together, and they increase the risk of atherosclerosis. The process starts when the LDL cholesterol, which is also called bad cholesterol, begins to enter the blood vessel wall, often because the lining of this wall is damaged by blood pressure. Patients with diabetes, particularly those who have high blood level of a fat called triglyceride and low blood level of HDL cholesterol, which is good cholesterol, these patients are more prone to develop this process. Therefore, even a slightly high blood pressure or slightly high LDL cholesterol can be dangerous for these patients. Once this process starts, the same factors cause it to continue to get worse, ultimately reducing the blood flow through these blood vessels as they start to get narrow because of deposition of cholesterol and fatty substances. And sometimes they can completely get blocked if a blood clot develops. And this is how patients may develop heart attack or stroke or sudden cardiac death. So to successfully address, prevent, or treat these abnormalities, we have to concentrate on cholesterol, blood pressure, and sugar abnormalities in a patient with diabetes. So although the average LDL cholesterol, the bad cholesterol in the US, is somewhere between 120 to 130 milligrams per deciliter, most experts and doctors recommend that patients with diabetes should lower their LDL cholesterol to less than 100 milligrams per deciliter. Actually, if you have diabetes with other heart risk factors, or if you already have heart disease, the goal is to lower the LDL cholesterol to less than 70 milligrams per deciliter. HDL cholesterol, on the other hand, which is good cholesterol, is called good cholesterol because it protects your heart by transporting cholesterol back to the liver. Keeping HDL cholesterol above 45 to 55 milligram per deciliter help reduce the risk of atherosclerosis or heart problems. Triglycerides are the other fatty particles in the blood, and often they are high in patients with diabetes. They are also increased if a patient consumes too much carbohydrates or starches. Keeping triglyceride less than 150 to 200 milligrams per deciliter also reduce the risk of atherosclerosis. And finally, blood pressure should be kept below 140/90 and ideally below 130/85 in patients with diabetes. If you're successfully able to do that, you can prevent the cardiovascular or heart complications from diabetes. And here's the outline of measures that can be taken to fix individual problems that can lead to atherosclerosis. As you can see, diet and exercise is important to improve each one of these. And beyond that, medications are useful. For example, statins are quite often recommended to get the LDL cholesterol levels to the goal we discussed. Triglyceride levels, if they stay elevated after fixing the diet and exercise, may require that you would have to take fish oil capsules. Particularly, there's a prescription fish oil called Vasepa, which improves cardiovascular risk. And blood pressure, fixing blood pressure involves improving weight, lowering the intake of salt, and using blood pressure medicines, particularly the ones belonging to the ACE inhibitor and angiotensin blocker category. If you already have heart problems or heart disease, taking aspirin can also reduce the risk of heart attacks and strokes. In the context of reducing the cardiovascular risk, it's important to note that improving diabetes control or glucose control is helpful, but not all medications that we use to treat diabetes are helpful for the heart. And there's some concern that some of the older medications, like glyburide or glipizide, may increase the risk of heart problems in certain patients and therefore should be used carefully. There are two classes of diabetes medicines that actually have an independent beneficial effect on heart and kidneys as well. The first group is called SGLT2 inhibitors, and they include Jardiance and Farxiga. And the other group is called GLP-1 agonist, and this group includes Trulicity, Ozempic, or Victoza. These two group of medications are now recommended earlier in the course of treatment of patients with diabetes because, in addition to improving diabetes control, they have a direct beneficial effect on the heart. In conclusion, the cardiovascular complications of diabetes are common, they are serious, and sometimes may be fatal. If you have diabetes, particularly type 2 diabetes, it's quite likely that you may have other cardiovascular risk factors such as high blood pressure or high cholesterol. And a comprehensive approach to managing all of these risk factors would be needed to successfully prevent development of heart problems and other complications. Luckily, lifestyle measures such as weight control, diet, they are key to managing all of these risk factors. And when lifestyle measures don't work, we have medications that can manage and prevent these complications. I hope you found the content of this presentation helpful, and it will help you manage your diabetes better. Please note that the information contained in this presentation was for informational purpose only. It does not, it's not intended to be a substitute for professional medical advice. Your healthcare provider knows your condition or situation well and can give you specific advice which would be appropriate for your condition. Good luck and goodbye.